Hi, welcome to 5-minute videos for the National Counseling Examination Review. This is Dr. Pepe. Today we are going to be reviewing section number 2, Intake Assessment and Diagnosis, and we are under subset K, evaluating an individual's level of mental health functioning. So let's first talk about what mental health functioning is. Sometimes you may hear Global Assessment of Functioning, or GAF score or GAF scale. And that is a score that is usually done in the intake process by a mental health professional in order to evaluate the individual's psychological, social, and occupational functioning. So it's meant to be a multi-dimensional assessment in order to give you an idea of how well that individual is functioning overall. And this is, in their professional, personal, relationship, aspects. So this score is supposed to give you an idea of just an overall function. It is used in the mental health field in order to determine interventions and care patient needs. So when we talk about level of care, sometimes the Global Assessment of Functioning, or GAF score, is used in order to determine what level of care this individual is in need of. In the GAF score is on a scale of 0 to 10. So you may get a number of 50, 60, 70, depending on the level of functioning. This GAF Global Assessment on Functioning scale is based off the Diagnostic and Statistic Manual of Mental Disorders, 5th edition, also known as the DSM-5. It is recommended as an assessment in order to gauge global functioning as well as impairments. So the GAF score, just to give you an idea, since it's a scale of 0 to 5, usually 91 to 100, the client is functioning at a no symptom or superior function level. If the score is from 90 to 81, then there are minimal symptoms, things such as mild anxiety, but overall good functioning. If the score is from 80 to 71, then some symptoms are present. They're temporary due to some stressors, but overall there's decent functioning in school as well as occupation. If the client is from 70 to 61, there are mild symptoms. You may have depressed mood, mild insomnia, some difficulty with social occupational, but generally functioning well. May have some interpersonal conflicts. If the score is from 60 to 51, you have moderate symptoms. Could have, panic attacks, difficulty with social, occupational, and school functioning. If you have a GAF score of 50 to 41, then you have serious symptoms, so things like suicide ideation, you have serious impaired judgments, and then you have inabilities to function or keep a job. If you're at 40 to 31, you're impaired. You have major impairments at work, at school, and relationships, and then your thinking, judgment, and mood is also impacted. If you're at a 30 to 21, then this would be considered the client could be suffering from delusions, hallucinations, serious impairments in communication and judgment, and then no functioning at home, job, or with peers. And then 11 to 20, this is in severe danger, suicidal attempts, manic, violent, doesn't maintain hygiene, just significant impairments in most aspects of life. 10 to 1, this is severe danger. This would likely require an inpatient level of care, not being able to take care of themselves, a clear danger that death is very likely. So that's kind of the scale of the global assessment of functioning, which is based on the Statistical Manual of Mental Disorders. So that's something to be familiar with, and something so that you know kind of what the general scale looks like. So that's something for you to know, both for the NCE as well as just in general practice.